Honorable Godi spoke strongly about the need to enhance the capacity of the state to deliver on government programs. We agree that a lot must be done in this regard. We have already put in place a number of initiatives since 2009 to improve the functioning of the state. The monitoring of management practices by the Department of Performance Monitoring and Evaluation in my office is already starting to bear fruit in a number of areas. For an example, the average time taken to fill a funded vacancy in national and provincial departments has improved from 9 months in 2010 to 4 months in 2012. The responsiveness of departments to cases referred to them by Chapter 9 institutions and from the National Anti-Corruption Hotline has improved. The average time taken to issue an ID book has been reduced from about 150 days to about 30 days. The barcoded green ID book will be replaced by a new ID smart card in the 2013-2014 financial year. The smart card is intended to prevent fraud. The average time taken to produce an application for a social grant has decreased from 30 days in 2010 to 21 days in 2012. As Honorable Minister Sisulu and Minister Manuel pointed out, the training of public servants, including managers, will be prioritized to further improve the capacity of the state. This should also bring in mind needed skills and reduce the money we pay to consultants, which the Auditor General and many honorable members here have raised alarm about. It is also an undertaking made in the National Development Plan that the culture and orientation of public service will change for the better. It is for this reason that we say, if that we are to pay public servants better, we want a return on our investments. We have also put in place mechanisms to improve citizen care and make the public service friendlier and more responsive. We still have a long way to go, but we have made a start. Important amongst these is the Frontline Service Delivery Monitoring Program. Over 300 unannounced visits were undertaken during the past year by officials from the Department of Performance Monitoring and Evaluation and offices of the premiers. Repeat visits to sites indicate that in many cases, the monitoring has resulted in some improvements. In this regard, Minister Sisulu is correct in her assertion that some of our public servants work diligently, putting in many hours a day to improve service to our people. A model example is that of Ms. Pierre Bengu, and Mr. Mondli Mazibuko, and the staff at the SASA office in Mzimkhulu. After an unannounced visit, they acted on the findings and improved the queue management, provided chairs and a shelter for the waiting area, and ensured that toilet facilities were working. I personally undertook visits to many areas under the Presidential Siyahlola monitoring program. For an example, in Mzimkhulu, we assessed the poor state of municipality services. In Ngobi village, in Hammanskraal, we went to check on the water delivery situation. In Gauteng, it was a review of public transport, and in the Eastern Cape, the visit concerned the delivery of school infrastructure. Ministers will be undertaking many similar visits this year as well, so that communities can raise concerns and suggestions directly to the ministers. We also continue to interact with the public through presidential hotline. By 31st January 2013, citizens had lodged more than 154,549 cases with the presidential hotline, of which 89% had been resolved. Mr. Sitiliban Kob from Tentane village, Butterworth, in the Eastern Cape, was able to obtain a wheelchair after calling the hotline on the 31st January 2013. Mr. Herbert Memela from Gauteng was paid by the Department of Energy for services rendered after the intervention of the hotline. There are many more examples of citizens who have been assisted. The culture of putting people first is being inculcated gradually. A better and more caring public service is possible, as illustrated by these cases. It should also be an inclusive public service with more women in senior positions, and also one which strives to achieve the 2% employment for people with disabilities.